Hello, everyone, and welcome. My name is Liana Ramos, and I'm the Marketing Associate here at JMIR Publications. I'm excited to welcome you to today's webinar, which is part of our JMIR Mental Health series in collaboration with the Society of Digital Psychiatry. Today's session topic is Growing Up Online, Social Media, Digital Therapeutics, and Youth Mental Health. We'll begin with that in just a moment, but before we do, I wanted to call out a couple of housekeeping items. Firstly, all microphones will be muted during this webinar. However, we encourage you to engage with the panel by submitting your questions. You can do this by easily typing your questions into the Q&A box, which is located at the bottom of your screen, and there will be a designated time for the panelists to address them. Additionally, we want to let you know that this event is being recorded, and the recording will be available on our JMIR Publications YouTube channel. So that's all from my end, and I'd like to introduce Dr. John Torous. Dr. Torous is the director of the Digital Psychiatry Division at Beth Israel Deaconess Medical Center, which is a teaching hospital of Harvard Medical School. He also serves as the editor-in-chief of JMIR Mental Health. So with that, I'll pass things over to Dr. Torous to introduce today's speaker and get us started.
Excellent. Thank you again to the JMIR Mental Health team for helping us organize this, and the Society of Digital Psychiatry. The website is sodpsych.com to find out more. But to kick us off, we have a very exciting topic and a really exciting speaker. So Dr. Ivanov is a professor of psychiatry at the Icahn School of Medicine in New York and is the chief of the Child and Adolescent Psychiatry Division at Mount Sinai Morningside Hospital. In his current position, he utilizes his clinical expertise in the assessment and treatment of youth with ADHD, childhood trauma, mood, anxiety disorders, and works of adolescents and young adults with substance abuse disorders. He's authored well over 100 papers, and as a practicing psychiatrist, has also really sees what's happening on the ground with youth and their families around technology and different changes. So we're excited to have someone really help us explore kind of the youth aspects of it. So maybe my first question, Dr. Ivanov, to get started is, how did you see digital device use change around COVID and after COVID and what you were seeing on the ground in New York?
Yeah. Hi, everyone. And first of all, thank you for the invitation. Thrilled to be here. That's, I guess, a very important topic for many different reasons. Although I don't necessarily specialize in digital therapeutics, through the work that I do, we kind of see that as new reality, frankly,
Yes.
for the next generations, not one generation, many generations. Let me start with kind of little anecdote, and that was maybe 20 years ago, and somebody was presenting on early development, meaning like babies, first year, and
Yeah.
they showed a little video of a 7-month-old child, a baby,
Okay.
in a magazine, looking at the picture and trying to enlarge the picture because they already had in their mind that they know digital is, allowing for that. So the point is, kids are growing up from day zero surrounded by that. And I think one of the main challenges is like how we foster that into being something that's helpful for development on one hand. There are certainly a lot of things that change around, let's say, education and parental guidance. So, for instance, in New York, as you guys may know, and I have actually two kids who kind of went through that, both college and high school, middle school rather. We are digital, meaning tele
Yeah.
education for about a year and a half. To the point that there was a whole discussion if we can transition altogether, regardless of the pandemic, into that, not taking into consideration the other aspects of school, which is like being physically with other children. But the point here is that children are so accustomed to dealing with those kind of technology. Uh, as this like little anecdote, they're exposed to it like from the very beginning. They're very familiar. They're very comfortable. One thing that I think we've kind of seen often is kids nowadays, middle school, teenagers, younger kids, they seem to outgrow their parents and grandparents in the level of ability to navigate and knowing how to navigate. So all of this talk about how much parental control is there is certainly useful, but you have to really take into consideration the different level of expertise as to what kids can do and pretty much like, you know, overcome barriers. I think one thing that has happened and is stays is, I'm sure that's another stays as well, but in terms of school, for instance, a lot of the homework and
Yeah.
assignments are digital. So often I see my son, currently like, junior high, on the phone. What are you doing? I'm doing homework, which is true. Yes, they're doing homework, but that creates this blurring of the boundaries. Where's the parental control? How much you want to allow for a child to do some of this homework, which for high school is like 2 to 3 hours. That's the norm.
Yeah.
And how much you want to kind of, control that or supervise. Is it even possible? So school is one part. The other part is, as we talk of digital therapeutics, kids are very familiar nowadays with ChatGPT, or AI, and all these kind of things. And in my mind, and I'll finish with that to kind of, allow further discussion. But when I think of digital therapeutics, there might be two ways to illustrate. One is it's very helpful if you want to collect data, let's say on self-reports. Like
Yeah.
if you use that technology for somebody to kind of provide additional information, this is how I feel in this particular moment. That's actually quite a bit of useful approach because you can get like real-time data. All the days when I remember it, you try to get an ADHD rating scale from the teacher. Well, that's a 3 month exercise of like going back and forth and this kind of thing. So if you think of digital therapeutics as data collection instrument, that's one thing. If you think of digital therapeutics as a AI type of device that simulates interaction with yet another entity, which is not human, but in 13-year-old mind, this is the best friend they have. We've heard from several kids. Then that becomes a completely different area of challenge, new
That
challenge.
maybe brings up two questions I want. Again, when you see a new young person in the clinic, I think classically in kind of mental health training, be it psychiatry, psychology, social work, peer specialists, we'd ask out things about what is your diet, what is your kind of environmental exposures, do you have green space? Are you finding clinically we're now trying to ask people about what is your technology exposure, be it to social media or AI? Has that kind of made it into the mainstream intake or evaluation yet?
Um, so there are different variations of that. That's an excellent question because I don't think we have kind of codified it as like, uh,
Yeah.
I'm coming from the times when we actually used to do live interviews, and there's kind of an algorithm of like you have
Yeah.
to touch on all the important issues of safety. And knowledge and use of social media digital devices, I think, has become a safety issue. It's kind of,
Yeah.
I don't think we have codified it as like you must absolutely ask for that.
Okay.
However, some of the kids, it's out there. They come with the phone, they stay on the phone because they try to, put some distance between you and them.
Yeah.
They try to indicate I'm not interested in being here. So there's one aspect of that. I think most psychiatrists at that point have the common sense of like set up rules of saying, as we're gonna talk, I would ask your mom and you like, abstain from the phone situation.
Yeah.
So my point is for some kids it's very obvious.
Yeah.
Some not so much, and it depends how the interview is gonna go. But what we've seen is the majority of like, more, how to say, not more serious, but kind of more concerning problems that are around safety in terms of self-harm or some interaction with others that could be considered potentially dangerous. I would say 99.9% is mediated to some point of with digital interaction. So
Okay.
it's the bullying online, or my friends are doing this, or they receive some information. I mean, very often kids who experiment, let's say, with no suicidal self-cutting, how they learn it, internet.
Is int- so it really makes, again, I'm going to make a bold statement, but we probably should be adding this as a routine thing. Like we ask about substance abuse. We ask even sometimes about, do you wear a seatbelt? That sounds
Right.
like we don't yet have a standard of what are your online exposures, be it good or bad.
Or at
It,
least maybe, I think this is frequently asked, which is what might be the rules.
yeah.
I mean, I can tell you that very often the presentation in the emergency room or intakes is like there is too much conflict around limitations with the Wi-Fi, the device, or whatever it might be, and that's where the problems kind of get triggered.
As you said, to your point, it seems like younger generations will find ways around these age verifications, whether you have them or not. I once read a statistic, I don't know if it's right, that said up to a third of youth at one point may have had a second smartphone to just go around their parents' systems. And you would just go to Walmart if you're in the US for $30, you could have a second smartphone and just connect to public Wi-Fi and could do whatever you wanted.
Uh, in terms of that and linking that to kind of more serious behaviors, actually,
Yeah.
we presented a couple of years back, I think it was 2024, in Seattle. There was a discussion around access to substances through social media. And one statistic that kind of gets stuck in my mind is if a teen, let's say, visits a new city and kind of tries to figure out what are the accesses, it takes literally minutes, like
Minutes.
2 or 3 minutes
Nuts. Okay.
to find something and be delivered. That that's yes,
Very good service.
it was absolutely frightening.
Oof.
And I think so. My point of like, it's not just the ultimate patrolling. This is like remove the devices or turn off Wi-Fi, which in many cases we actually have given that very direct advice to parents. Unfortunately, many times the whole situation can escalate to the point that that seems almost impossible to happen. But that's a discussion for another day. Uh, but when I think when we're also lacking behind is I don't think parents are fully aware of what is possible to happen when kids have access to not just internet, but the dark web, because they do, or what kind of things they can do by just being so proficient on that. Like pirating, for instance, is one thing that kids are doing all the time. They don't want to pay for music, they don't want to pay for films. And you ask them, it's like, oh yeah, there's gazillions of lines, of sites that offer that.
Yeah.
And I think often parents are just not aware of that.
And one recent trend is I want to get your take on as a child psychiatrist is about last week, OpenAI, who makes ChatGPT, said we're taking away the ChatGPT 4.0 model. This was the model that was a little bit perhaps more sycophantic, but a lot of people actually seem to have developed relationships with the model. So last week when OpenAI said the model is going away, there's this whole community on the internet trying to like keep this model because they're saying you're ending a relationship. You're taking away ChatGPT 4.0. This is who I talk to. This is my relationship. People really are upset. It's almost like they're going through a breakup because this model, the chatbot, is being deprecated by the company. Have you seen kind of over time more of these new parasocial relationships that young people are making, or is it easier to make a relationship with technology and then in lieu of real relationships, or have you seen kind of these it's a real breakup. It's like a breakup with a computer.
I'm glad you mentioned that because there was something in the news um, the last couple of days, like over
Yeah.
the weekend. So there's a group in Colombia, and the news was that it's developing a humanoid robot that actually can move their mouth in
Okay.
synchronization with, like, let's say, a song. So it certainly mimics what a person would say. Like you can read the lips kind of thing. Lips, you know
Yeah.
what I mean? So my initial thought of that was like, why is that necessary? I mean, that certainly facilitates further attachment, if you will.
Yes.
And I look at, the sophisticated machines, and my think was like, yes, that exactly would facilitate creating this bonding that humans are, very prone to, especially younger, more immature children. My analogy, we had a conversation at home, and I was like, when the washing machine breaks down, I'm not upset. I'm just going to replace it.
Yeah.
Why the robot should be any different than that? I can see the utility of those kind of machines helping. So the whole issue was like, well, there's going to be like home helpers, people who are
Yep.
disabled, people who need some addition, people who live alone. Great. let's do that. This never tires, it never falls asleep. It can help in many different ways, but why should I attach to that machine the same
Yeah.
way that I might be attaching to a child? And I mean, to another person. For younger children, especially the ones that are like preteen or even teens who are kind of more childlike, for many reasons, we had a case when, as the child was speaking, they didn't want to give up their phone, and as they were speaking with the psychiatrist, like, oh, let me ask my companion. So they have like a therapist in their pocket, pretty much. That is
Yeah.
more important than the person that they're talking to. And I think with this kind of a making the machines more human-like, which I understand some of the rationale behind that, but that's also definitely would facilitate this attachment process to be, yes, you're breaking up like with another person when there's nothing to do with another person. It's just kind of an algorithm.
Yeah. No, I think it's a new phenomenon I think we're going to have to handle because clearly there's harm of it giving you bad advice. We've seen lawsuits about death from suicide,
Yeah.
but there may be this harm of you form these relationships and they end. And this is a paper that I didn't write, you didn't write, and put in a chat, but it came out last week in JAMA Network Open, but it was a company that does kind of internet security, but they used objective data on what percent of people age 4 to 17 are using LLMs. It was basically 32% of young people, objectively, this is not self-report, by looking at the internet traffic. So this is happening, right? And again, research papers are delayed. So this data was from like April 2025. So it's almost a year old.
Yeah.
But it's pretty wild that again, and use was pretty high even when 13 and 14-year-olds. So I think your point of what you're saying is this is moving forward.
It is moving forward and
Whether
moving very fast.
it's very fast and it probably doesn't, I think it's hard to ignore it in a clinical exam at this point because this is a huge, I mean, call it environmental exposure. It's a digital environment, but we are having people that are living in these digital environments that are not designed for safety. And again, there can be benefits. I think we've seen on our kind of,
If I can just comment
yeah,
on the safety issue. So one huge problem with the safety issue is that, even if the algorithm or the machine, AI, whatever, is designed with certain, guardrails and protection and whatever it might be, the safety issue usually arises around context in a
yeah,
conversation. So, for instance, if I'm sure that all the people here, if we design like a topic and all of us ask AI in a certain way, you may get like 50 different answers because the way the question is phrased, that's how AI actually interprets it. And this is the data that they pull out.
yeah,
In contrast, if you have the same topic and 50 clinicians ask given in different ways, most of them would get the context and understand that it's about one singular issue, and they'll be able to extract that particular issue that is of most importance in this particular situation. I think that's where the big difference is. It has no concept of like what context is. And all of us asking questions or making an inquiry put some context in it willingly or unwillingly because that's how we communicate.
yeah,
Humans get it even if it's not spelled out. I don't think AI has the ability to extract that kind of additional meaning. And I think that's where the breakup comes in terms of kids are asking a thing, they're getting something which is always designed to validate in some positive way without the context, and then they can get information that is harmful, as we know,
yeah,
and they themselves, I mean, the children, especially the, kind of younger kids, more immature, would not have the ability to kind of filter that, and they just take it like in face value.
yeah. Maybe one more question before I open up just to
Yes.
questions and discussion is you work with a lot of young people with ADHD. In your
Right.
clinic, you've done a lot of research on them. Do you think there's anything unique about the profile of young people with ADHD that makes them more vulnerable, more able to benefit, or react somewhat differently to this kind of new technology that we're facing?
Um, so in terms of children who may have either ADHD or any kind of a developmental disability,
Yeah.
there is one feature that is not just the hallmark of ADHD, but like people who have autistic spectrum disorder, which is uh, tendency to kind of hyperfocus. So ADHD is like hyperactivity attention deficit disorder, and usually the attention deficit is manifested towards things that are kind of tedious, less interest, demanding. However, many children with ADHD actually hyper focus on things that they're interested in. And the things they're interested in usually things that provide a lot of novelty. ADHD individuals actually could function pretty well if there is an environment that provides this constant stimulation. Very kind of a short anecdote, but that was a young person that we're treating here, and their job was like they were a manager on a, you know, they're shooting commercials and things like it.
Okay. Yeah.
So they had like two cell phones, three pagers, and the question is like, how are you doing your job? And it's like, I'm great because these things go on all the time, and I'm
Yeah.
actually very good in kind of attending to all of this. And what happens when you go home? I cannot pay my bill because this is the most boring thing on earth. So I have like electricity bill from the last 6 months sitting there and nothing being done. That's not an exaggeration. That was kind of a
Yeah.
paraphrase of the report. So ADHD has this ability for certain things that are novelty providing, which is what we're talking about digital.
Yes.
So they might be more vulnerable in kind of being sucked into that in particular area that they find particularly interesting. Now, in kind of fairness, I think all adolescents have that propensity to kind of hyper focus for a certain amount of time and develop a
Yes.
new interest for 3 months. And I'm going to become ornithologist, and then 3 months later, I'm going to be a dancer. So, that's kind of normative.
Yeah.
But I think kids with either autism, spectrum disorder, ADHD have that propensity for this impulsive behavior is turning a little into kind of a compulsion. And yes, they're probably more vulnerable to
And
those
I'm
kinds.
taking away again, we probably should be asking every young person about it, but especially in those populations where there's, again, perhaps there's more vulnerability to it, especially with it. Maybe to jump to some of the questions I
Yeah.
see, one question says, clearly, we know there can be a lot of misinformation online. And again, young people are learning about the world. It's harder to sort through it. Do you think, kind of as a clinical community, do we have a duty to not correct every piece of misinformation, but to talk to people about how to search for information well online? Do we have to put up our own information? Like, how do we combat all of the wrong information on the internet about mental illnesses and now that chatbots may be giving to people immediately?
Right. I mean, I wish I
A
had
hard
the
question. It's a good question, but
I mean, the first thing that comes to mind is certainly what some communities and countries are doing, which is limiting the access of younger people just because, I mean, so it's like all or nothing kind of approach when
yeah,
we cannot fix that, meaning it's impossible to patrol the internet and, police it and make it all kind of validated and things like it. We know about all the push in reverse to that. We're not publishing, we're not censoring, all this kind of thing. I think it's helpful to have rules from the get-go. So if one thing I'm to advise parents about all this
yes,
is like, look, there's no reason 7, 8, 9, 10, 11, 12-year-olds to have smartphones. If you're concerned about safety, first of all, uh, up to middle school, I think we have enough kind of a social guards as to how you can chaperone kids and make sure that they're safe and this and that, whatever. If you want to give them an old-fashioned flip phone so they can call you, okay, so be it. Do that. But there is no reason to have a sophisticated computer in the hands of a 10-year-old and they have access to like God knows what. Because I don't think parents would be able to patrol that regardless of what they say. It's totally impossible. You guys, I'm sure you know that Australia and other countries limited internet access to 16 and over. Some people would tell you that even 16 is like too young. But I think we need a really concise effort of parental education around that in terms of just making parents aware that they have to do their own homework to educate themselves. I don't think providers can educate them enough. We have to educate them about many things, about the condition, about the medications, and things like it. So it's an ongoing kind of a moving target. But I think similar to what we have right now, I think just sounding the alarm on like there is more out there than you can think of. Now, one thing that I found very helpful is make your children, collaborators and all that. If you want to play dumb and ask them to educate you. I mean, I've learned
Ah,
quite a
oh,
bit
I like
from
this.
my 17 and 24-year-old about a lot of things. We share interest in music. I know more about music now just because they,
Yeah,
come and tell me things. And I know more about the dark web and things like this because of them. So I think parents would be better off instead of picking up a fight about how much this and that and whatever. Establish the rules from the get-go, which is fine. And then ask your children to educate you about what kind of things they're interested in and what is available out there, because that might be a better way than trying to be the policeman of all this.
yeah. As you said, it sounds like a impossible battle because people always find new ways to get around these internet restrictions. So why
Oh,
why
yeah.
also fight a losing battle, which you
Right.
can't?
I think that battle is lost from the get-go. Of course, there's some reasonable ways to kind of, put guards, but
Yeah.
I don't think you'll be able to kind of bulletproof anything.
Yeah, and I see a question comment saying, my concern is that there doesn't seem to be as much consideration given or steps put in place to manage the impact of AI like ChatGPT being retired on those struggling files. So we talked about when the model goes away, people can feel pretty upset, emotionally, perhaps even depressed or anxious. The conversation always is kind of saying on the outputs, again, these harmful outputs it can do, which we have to acknowledge. But what about the destabilization again for people that rely on it for emotional support and it goes away? So I guess the question is there's two harms. It's harm in using it, but for the many users who are there, and again, I put a link, you could argue at least a third of people, if not more, young people are using it. It's a really big deal if a third of people have to go through a breakup or a relationship. You could almost argue no one has the data, but there's more harm by ChatGPT 4
Yeah.
going away with it. And how would we even help? Again, we don't even understand the impact of a breakup of AI, but how would we help parents or young people think about that potential harm from a breakup, I guess is what the question is saying. And we kind
Yeah.
of covered it, but it's new.
Right. I mean, so on some level, this is like if you want to equate the usual angst of being a young person in this relationships being very volatile. My friends were my friends, and then Wednesday something happens, and now we're enemies, and then we're frenemies and things like it. So maybe on the positive side, to put it a little bit of a positive spin, young young individuals in general are resilient, and they can bounce back from all kind of I think they also have enough, the majority have enough common sense to kind of be counseled around certain things, at least have a conversation. I think it's on two. So, if you come to think about it, the way this is supposed to work is actually digital devices or just kind of a therapy helpers or whatever you call it, they were supposed to be prescribed by somebody. They're supposed to be
Yeah.
actually some guidance as to how to use those things. This is where the danger is. And Johnny maybe remember when we're talking about the paper, I always was concerned that if one child gets it in the class, inevitably almost everybody else will,
Yeah.
because they're like, oh, let me show you this great thing I discovered. And it doesn't matter who prescribe it or doesn't prescribe it, they're going to find a way. So for people who kind of really find these things helpful, I really hope that there will be already some kind of a conversation with a provider or a family that they're using that. I think the really vulnerable individuals are the ones who solely rely on that, which we've seen from these recent lawsuits when a person gets isolated and that becomes the only source of information, support, and whatever it might be. So this thing of what I mentioned in the previous, parents being, I call it a little bit of a psychological bribe, but tell me more about it, educate me about it. You're the smart person. I think that would go a long way because most kids, and we're going like way back into the age of psychoanalysis, but one of the people who established kind of the initial understanding of child development, Winnicott, put
Yep.
something which is, I think, still holds, which is the child wants to please their parents in general. They would like to do things that their parents would like and appreciate and whatever.
Makes
So
sense.
parents could take that and run with it without being punitive, but being more like, I'm curious, why don't you show me more about it? Oh, this thing happened. Oh, and well, go educate yourself exactly, I mean, the parents, what happened around that, and talk to your child about it.
Yeah.
I mean, that's probably the only way I can think of. I don't think we have enough providers to jump in and fill in the void because just the reality is that.
Yeah. No, I like that that's very practical advice because sometimes these AI discussions become very theoretical. If only AI would be all perfect and good, the world would be a better place. And we're saying, look,
Oh,
there's some good, there's some bad. Let's work up the realities of technical safeguards aren't going to keep people offline forever. People are using it. Let's be realistic about it. So that's pretty much all the time that we have. I put our group's website in the chat if people want to find more webinars. But thank you so much, Dr. Ivanov, for giving us just practical, hands-on advice from what you're seeing on the clinic, on the ground, from research. It's a very nice kind of different type of conversation in these kind of theoretical ones. And to everyone for tuning in, thank you. If you go to our website, sodpsych.com, you'll find more webinars every month and more resources around all these topics. So till next time, bye.
thanks for the invite. Thanks, everyone.